sensitive topic that every man talk about, but it's very important to at least discuss it in the first session on your evaluation. All right. So before we begin, I'd like to share this disclaimer. Please note that this presentation doesn't replace medical advice or formal evaluation, and I encourage you to speak with your doctor or request a referral to a public health specialist. And I'm not endorsing any products. I will be just talking to my best knowledge, skills, and interest for your best welfare. All right. Thank you for inviting me again. It's always a pleasure to share my experience working with each of you. This time around, we're going to focus about sexual rehabilitation. I hope this will open up a lot of avenues and letting go of all the hesitations that you have. And we shall talk about this publicly. Before we begin, I want to say thank you to everyone who has reached out to me and trusted me to help them, whether that's giving advice on managing urinary incontinence, getting back into sports, spending quality time with their family and friends, or simply feeling relaxed and confident in everyday moments. Artizo is currently in Falls Church, so if you ever need help, feel free to take a photo of that QR code on that screen to get more information. And you will be seeing this QR code in all the slides. I want to tell you why we're even having this conversation. After your treatments, the reality is changes in sexual function are most common than most of you have told. And these aren't just numbers on the chart. These are the things that affect your confidence, your relationships, and how you feel about yourself. Researchers researchers show that up to 68% of men experience erectile dysfunction after surgery. Nearly 1 in 3 men leak during orgasm, and that's climacturia in medical term. More than half notice a decrease in orgasm intensity. And about 1 in 5 men say they cannot reach orgasm at all. 15% of you feel pain with orgasm, while around 58% notice penile shortening, sometimes over a centimeter. And about 16% develop Peyronie's disease. That's the curvature of your penis that can make intimacy challenging. And here's the big one. After your surgery, 100% of you have an ejaculation, meaning no ejaculation during orgasm, nothing will come out. When you all add up, when you add all that up, it paints a clear picture of each of you. This isn't just about one problem. It's about series of changes that you experience after treatment. I'm sharing this with you not to scare you, but to let you know that you're not alone and that these challenges are common, real, and absolutely worth addressing. You are sharing these problems. And this is why I'm here today, because sexual rehabilitation is not a luxury. It's essential part of your recovery, your quality of life, and getting back to feeling yourself again. What does the American Urological Association say about this? The purpose of this guideline is to provide all of us a clinical strategy for the diagnosis and treatment of erectile dysfunction. Using the shared decision-making process as a cornerstone for your care, we should be informed of all the treatment modalities, regardless of invasiveness or irreversibility as first-line treatments. Now I'm sharing this precious time with you, and I'm telling you there are solutions. So our objectives for tonight are the following. First, I would love to increase your awareness of your physical, psychological, and vascular changes affecting your sexual health after prostate cancer treatment. Second, to introduce everyone evidence-based rehabilitation strategies that will support your recovery, function, tissue health, and your confidence, while emphasizing the importance of your individualized evaluation and your early intervention. Lastly, empower each of you to take proactive steps toward restoring your intimacy and quality of life by understanding the role of your pelvic floor health, circulations, your lifestyle habits, and collaborative care. Before we go deeper, let's take a moment to look at your muscles, nerves, and blood vessels that work together to get hard on. First, the two major voluntary muscles, the the bulbous spongosus, which found at the base of your penis, ischocavernosus, one on each side, running along the legs of your penis. Both of these muscles contract and pump blood into your penis, helping you get hard and maintain hardness. Next, the blood supply. The penile arteries delivers blood into your penis. And during erection, this penile tissue expands and compresses the deep dorsal vein, trapping the blood inside, giving you erection. Lastly, the nerves. The cavernous, so this are the cavernous nerves that are the primary on switch for our erections. They tell our smooth muscles to relax and release nitric oxide, which starts the whole process of blood filling our penis. These nerves, along with the blood vessels, are tightly packed behind and around the prostate, which is why they can be directly affected during prostate surgery. Then there's this pudendal nerve, which has two important jobs. First, to carry sensation from our penis back to our brain, where it connects with our memories, feelings, experiences, and desire so we can get hard. Lastly, it controls the contractions of the previous muscles I've mentioned that create hardness in your penis. So when we put all of this together, we can see that there are three major aspects we can focus in our treatment: the mindset and the nerve, the muscle activation, and the blood flow. So we can have the hardest hard on during self exploration or with our partners. Now that we have the basic understanding of that area, let's review the common treatments for prostate cancer. Surgery, the most common procedure is the radical prostatectomy. It is a complete removal of the prostate gland, often including a seminal vesicles. And in 1980s, nerve sparing technique was developed. Its main goal is to preserve the nerve. Since the early 2000s, robotic assisted prostatectomies have been developed. Studies have showed that these procedures have improved visualization and precision of the surgery, which helps preserve the nerves and the blood vessels important for erections and urinary incontinence. Another one is the radiation therapy. It emits high energy rays to the prostate from outside the body. It is important to remember that erectile dysfunction isn't just about physical changes. That happens after any forms of treatment or even when your doctor have told you the sad news. Please note that there are mental and emotional impact. After you have known that you have cancer, you already have an emotional trauma. Some of you have already heard and rationalized it's all in your head. It will come back in 6 months after your surgery. Don't worry, it will work again. Or the mindset of you want to get rid of your cancer so you can just live longer. Then months and years go by, things still are not working. It's clear that there's more to the story. This is where the sex therapists, psychologists, and other healthcare professionals can help. The American Association of Sexuality Educators, counselors, and therapists share an interest in promoting understanding of human sexuality and healthy sexual behavior. On the other hand, certified sexologist emphasizes a body-centered approach to sex education and healing. They are all trained to help you understand your sexual health, develop strategies for improving your sexual function and satisfaction, and navigate your challenges related to your sexual intimacy. This form looks familiar to you, but I would like to show this to you again. This is what we call SHIM, short for Sexual Health Inventory for Men. It is a short 5-question survey designed to get a snapshot of your erection quality and sexual confidence over the past 6 months. It asks about things like how often you can get erection, how firm is your erection, whether it lasts long enough for penetration, and how satisfying you are with the intercourse. Each question is scored, and the total score helps us understand if there's mild, moderate, or severe erectile difficulty. Across all SHIM levels, exercise, pelvic floor rehab, lifestyle changes, and partner communication will improve your erection. Here are the 5 ways I can support you as your male pelvic floor physical therapist. First, I can teach you how pelvic floor muscles contribute to erections. Second, I will improve your blood flow through targeted exercises. Next, we will address your scar tissue and mobility limitations. I will help you manage contributing conditions like hypertension, diabetes through movement strategies. And lastly, we will build your confidence again, reduce your anxiety about sexual activity. From the very beginning, many doctors will prescribe you a low dose of Viagra or similar medications before your surgery and again right after your surgery. Before surgery, it is needed so that it will promote blood flow to the tissue regularly, keeping your penis healthy going into the operation. And after surgery, its main purpose is to maintain oxygen and circulation in your penis, prevent long-term changes like shrinkage or scarring,
How's it going? How are you? All right.
sexual activity whenever you're ready. The American Urology
Right.
Association strongly recommends and find this first line of therapy for erectile dysfunction. There are also natural food sources that help boost nitric oxide production, which can help support healthy circulation. And that's what is you can see in your screen. Nitric oxide plays a key role for erection. Once it is released in your penis, it allows more blood flow, creating firm erection. You can boost your nitric oxide naturally with what you eat. Foods like beets, spinach, and arugula are nitrate rich. Watermelon has L-citrulline, which your body turns into nitric oxide. Garlic, onions, pomegranate, and even dark chocolate also help you keep those blood flow vessels that also help keep your blood vessels healthy. So while the medications can help. So your daily food choices can also support better blood flow and better erections. So start thinking about your dinner tonight and plan your week ahead so you'll have the highest boost of nitric oxide in your penis. I believe that all this Walter Reed offers or provides vacuum erection pump, and I hope they're also teaching you how you guys on how to use it. All right. So your doctor, your nurse should be giving you some instructions on how to use it because it is different. It has a different protocol from different doctors or even from the manufacturers. Remember that this pump is using negative pressure to bring blood flow to your penis. The main purpose is to maintain your health and elasticity of your penis, not just to create erection. Researchers show that using a pump early after prostate surgery can help preserve penile length, maintain oxygenation, and support your erectile recovery. But it's only if it is used correctly and consistently. You are a conservative person and don't want surgery, there are studies that prove sexual satisfaction by using sexual aids and external penile support devices. We have discussed earlier about the vacuum erection device. One thing to keep in mind is that the hinge effect of the pump. This is when the base of your penis is soft while the rest is hard. And because of this, your penis can bend or buckle during intercourse, making penetration difficult and sometimes uncomfortable for you and your wife or your girlfriend or boyfriend. And this greatly affects the movement during your sex. It affects your trusting motion to your partner. On the top left photo, there's what we call external penile prosthesis in medical terms. But in plain English, think of it like a strap on designed for your penis. Some men can reach orgasm using it even without natural erection. Next, we have the penile sleeves. These fit over your penis, come in different sizes and shapes and thickness, so you can leave your fantasy size and thickness. Some need harness, others don't. They can help you with your penetration and sensation. There's also the elator, which supports your penis by holding the head forward, bracing the shaft, helping you maintain the position for intercourse. Right in front of you are the other medical interventions that was recommended by American Urological Association, written last 2018. If the oral phosphodiesterase inhibitors 5 or Cialis is not enough, you can use pumps, penile injections, or suppositories. For those ready for a long-term solutions, penile implants are the reliable choice with high satisfaction. Arterial reconstruction is for selected younger men with vascular blockage, but not the venous surgery due to lack of evidence. Importantly, procedures like shockwave therapy, stem cells, and PRP are still considered investigational or not recommended. A large review in 2023 looked at 11 high quality studies with over 1,000 of men. And they compared guys who did regular aerobic exercise like brisk walking, cycling, swimming to those who did not change their habits. The results is the exercise group saw an average improvement of about 3 points on the standard erectile function score. And that's enough to move someone from mild ED to a normal function. And men who started with more severe erectile dysfunction saw the biggest improvements.
Hey, Dervin,
Even if you're not working well right now, your body still has the potential to respond. Moving on, the American Urological Association guidelines don't always call out for exercise by name, but they strongly support discussing all treatments paths, including lifestyle changes as first line options. In fact, they have stated that men who received tailored advice on exercise, diet, and weight loss were more likely to recover normal function after 2 years than men who only received general guidance. American Heart As- American Heart Association mentioned lifestyle changes, and that includes checking your overall health, above and below the belt. Um, how much do we allot in a day for exercise? Well, it is recommended that at least 150 minutes per week of moderate intensity aerobic activity or 75 minutes of vigorous aerobic activity or a combination of both, preferably spread throughout the week. In addition to high intensity muscle strengthening activity, such as resistance or weight training on at least 2 days per week. So remember, you have to do aerobic training on top of your 2 weeks weight training to improve blood flow to your heart and to your penis. If blood flow is poor, we have to ask why. We have to ask ourselves how well I am in managing in these conditions. If anyone here who has hypertension damages vessel lining, reduces penile blood flow. Diabetes affects blood vessels and nerve supply to erectile tissue. High cholesterol leads up to plaque buildup and narrowed arteries. Heart disease or peripheral vascular disease reduces overall circulation. Obesity linked to hormonal changes and inflammation. Smoking damages your blood vessels and lowers your nitric oxide. Excessive alcohol. It affects your nerves, signaling, and hormone balance. Are we living in a sedentary lifestyle because it affects our nerve signaling and hormone balance? It weakens our cardiovascular and pelvic muscle health. Are you stressed or depressed? This impacts your hormone regulation and sexual response. All of these will lead to low testosterone, which reduces your libido and erectile quality. If you are sleeping with a CPAP, this links to a low oxygen levels and hormonal imbalance. Do you have previous back, hip, knee pain, or even your jaw? Because pain disrupts nerve signals to erectile tissue. Are you taking certain medications such as blood pressure drugs, antidepressants, or prostate medications? All of these could affect the nerves, the blood vessels, your mindset, your motivations, your confidence. And as your PT, we have to look we have to look all of this so that we can design a customized program and exercise for your recovery that works with your abilities, health conditions, and personal goals. After your surgery or radiation, scar tissue may form in the surgical area. And over time, this can limit your movement and cause discomfort. The solution? Move and stretch those tissues. With skilled, respectful, hands-on techniques, I can help you stretch your hips, back, and even your pelvic floor internally. Together, we can find and release your areas of muscle tension and scar tissue, which will improve your blood flow, movement, and performance, and muscle activation that is very specific on your favorite orgasmic sexual position. At home, you can use tools like foam rollers, tennis balls. However, we're going to trash those out because there is something specific for your needs. You will have your own massager specific for your pelvic floor muscles. You can see four different pelvic ones to massage your own pelvic floor muscles. They are bendable for easy reach, temperature adjusted for those who like it cold or icy, vibrating pelvic one for like those CrossFit who does for like for those who do CrossFit. And after you stretch, you also have to do some weightlifting. What you're seeing right now is like your barbells and dumbbells of your pelvic floor muscles. If you are questioning how many times, how long, what position, how many times a day can I rest, can I just walk my dog? The answer is this research answers those questions. This study read 24 studies and discussed the prescribed exercises. As your PT, we will apply this to your own exercise program. So I'd like to share a story of someone who has shared his sexual experience with his wife. When he was having sex, he saw a urine coming out of his penis when he's still not feeling the orgasm. So this study believes that your inner urinary valve in your bladder is removed or weakened during surgery, or during your orgasm, the external urinary valve relaxes naturally, or because you have your shorter urethra or penile pipe after surgery, or the bladder contracts at the wrong time. These are all possible theories, and they were recommending pelvic floor muscle training, physical therapy to improve the coordination and function during erection and ejaculation, with or without penile tension, loops, or cock rings. All right. So when you come in for an evaluation, you can only expect a respectful, fully consented assessment of your challenges, a review of your medical history and current concerns, a personalized treatment plan to improve flexibility, strength, and confidence. We will collaborate with other healthcare professionals such as sex therapists, psychologists, urologists, massage therapists, fellow physical therapists, or even neurologists to ensure you have the best support for your system. I hope by the end of this talk, you have learned that erectile dysfunction and climacturia are common, and there are science-based solutions to improve them. What's good for your heart is good for your penis, and it takes three to tango. What I meant is blood flow is needed along with a good muscle performance, unrestricted nerves, and right mindset. And please start early. Start your physical therapy rehabilitation. Exercise and protect your tissue before and after your surgery to make a big difference. Take advantage of the resources around you. Your plan should be personalized. What works for you may not work for others. And lastly, you don't have to live with it alone. Your first step is taking an action. Come and see your male pelvic floor physical therapists or other pelvic floor physical therapists to work with you to regain your control and confidence. Again, it's an honor to be part of your journey. Never hesitate to reach out if you have any questions, and good morning and good evening.
Okay.